Good morning, everybody. We're just waiting for a couple more people in the waiting room to come in, and then we'll start. We really appreciate you joining us on so close to the holidays for this really interesting conversation on AI in healthcare. And this is the second in the series that ANADAC and P2P have been jointly hosting. And we are very fortunate to have amazing speakers and amazing moderators. And so we thank everybody for joining us um, at different time zones. So good afternoon for people who are in zones where good afternoon or good evening, and good morning for people on the US side. So thank you so much for joining us. So on behalf of ANADAC and P2P, I welcome you to this session. Jamie, I cannot see the agenda, but I will hand over to Dr. Mehari, who leads and the founder of P2P, to provide a few remarks and introduce our the special Professor Abebe, who will be giving sort of the special remarks, and the opening remarks may come a little later, but we're really very grateful. I mean, we really think that AI can be so disruptive in emerging markets in Africa, particularly, especially, when you look at what mobile phones did in the world of computing. I always tell people, emerging markets, computers did not disrupt most emerging markets, including Africa. It was the mobile phone that did that. And as many of you know, the mobile phone today is much more powerful than many of the mainframe computers were 40, 50 years ago. And so this is such an interesting time to be having this conversation. Dr. Mehari, over to you.
Um, so good morning, Dr. Egbe. Sorry, I'm on the road, and so my video will be off. But good and good evening to colleagues joining us from across Africa and the global diaspora. On behalf of People to People and the Anandaj Group, I'm delighted to welcome you to the second webinar in our series on AI in tertiary education with a focus on healthcare. Today's theme, AI in clinical practice and continuous training and capacity enhancement, speaks directly to one of the most urgent challenges facing health systems today: how to prepare healthcare professionals and institutions for a rapidly involving digital future. Artificial intelligence is already influencing diagnosis, treatment, planning, and the medical education. The real task before us is to ensure this transformation strengthens human capacity, supports clinicians, and improve equity in care. At P2P, people to people, our work has always emphasized people-centered solutions, long-term capacity building, and partnerships that connect local institutions, the diaspora, the global collaborators. Together with Anandaj, we believe AI should be a tool that empowers, not replaces, health professionals and educators. We are honored to be joined by Professor Ababa for the opening remarks, and grateful to our distinguished speakers and moderators for sharing their expertise, and your participation reflects a shared commitment to shaping how AI is responsibly integrated into healthcare education and practice. I encourage active engagement and thoughtful dialogue throughout the session. With that, it's my pleasure to invite Professor Ababa, who is a Vice President and a Dean at the University of Global Health Equity. He is also the Secretary of Medical Education Consortium in Africa. Last I had the privilege to attend this amazing conference that was organized by him. There was like 137 medical schools dean gathered in Kigali, over 600 participants, focusing also on AI and higher technology. That he is a leader to bring together African medical schools, deans, and one healthcare, one solution, and a standard. So it's a great opportunity to have him today. And Dr. Ababa, obviously, you don't need that much introduction, and you are a known quantity. And now the platform is yours.
Thank you very much, Dr. Naugao. Good morning, good afternoon, as the case may be, to everyone. I hope all of you can hear me. Let me begin by extending my sincere words of appreciation to Anadaj and People to People for inviting me to join this webinar on clinical practice and AI in continuous training capacity building in healthcare space. As Dr. Naugao said, I'm a surgeon by training, and my further trainings are in medical education, research, and global surgery. Hence, I may not be the right person to discuss AI and technology with you, but I'll try to approach this topic from a different angle. The central question before us at this time is no longer whether artificial intelligence and technology will shape healthcare. The question has already been answered. They are here to stay, and we have seen what is possible. As the distinguished panel will thoroughly discuss later, AI and digital technologies can extend expertise to areas where specialists are scarce, such as rural hospitals and conflict-affected settings. Decision support tools can help clinicians make better decisions with limited resources. Telemedicine can connect patients to care they would otherwise not have access. Digital platforms can support task shifting, empower nurses, and so on. And in theory, AI can potentially democratize expertise and education. However, the real question is rather uncomfortable, and in my opinion, most important. Will they reduce inequities or quietly reinforce them? But theory is not a reality, because AI does not inherently reduce inequity. Access does. Without access to connectivity, devices, data, and digital literacy, AI becomes just another tool of exclusion. And history has taught us this lesson before. During COVID-19, vaccines were developed in record time, one of the greatest scientific achievements of our era. But access was not equitable. While some countries debated booster doses, others waited months, even years, for their first shots. The science was global, but access was not. So we must ask ourselves, will AI follow the same path? Will it primarily benefit those who already have resources, infrastructure, and power? Or will it deliberately be designed, governed, and deployed to serve those who need them the most? If AI is concentrated in elite institutions and urban centers, inequities will widen. But if it's designed for low research settings, offline capability, affordable, context-aware, then inequities can narrow. I believe the technology itself is neutral. Our unfortunately not. This brings the second question, equally important question. Are we prepared for the future, especially in Africa? I want to focus on the younger generation and why we must start early. The future health workforce is already digital. We must not train our professionals for yesterday's systems. Medical students and health professionals should be introduced to AI, transformative technology, digital ethics, data literacy, and clinical decision support tools from year one, not as electives or webinars, but as core competencies. Early exposure matters. It enables learners to view AI as a tool rather than a threat. It helps build critical judgment rather than blind trust. It empowers them to shape, even create technology, not merely consume it. If we delay this education, we risk creating a generation of clinicians who use powerful tools that they do not fully understand, or worse, who are excluded from using them altogether. For medical education and health systems, this means AI literacy must be as fundamental as anatomy and physiology. Training must emphasize the ability to create technology, human oversight, ethics, biases, accountability, and professionalism. And institutions must invest not just in innovation showcases, but in equitable digital infrastructure that reaches beyond big hospitals to district and rural facilities. Let me conclude with this thought. AI and technology may well shape the future of healthcare, but the future is not yet predetermined. It will be shaped by our choices, policy choices, educational choices, and investment choices. AI can reduce inequities in access to healthcare, but only if access to AI itself is equitable. The most powerful intervention is not the algorithm. It's the education that shapes it, started early, grounded in ethics, and available to all, especially in Africa. I'm looking forward to the conversations of the experts in this panel and in this special session, and thank you so much for inviting me. Thank you.
Thank you so much, Professor Abebe. That's such a wonderful way to start the conversation. And as somebody who went to medical school, I think almost 40 years ago, in a few years, I love how you said AI has to be basic part of anatomy, physiology, and biochemistry, which was often the basis of many medical school education. I think this is really an amazing framework for the discussion ahead. And I really thank you. And I suspect that we might have some questions for you on this actual statement, but we'll take them around. I hope you can wait for the first session. So if there are any questions for Professor Abebe, and I notice there's several professors and academics on the line. One of the reasons why we're focusing this on tertiary education is that young people seem to pick up AI and technology quickly. It is it is the policymakers, the folks, the guardians of education like yourself that are so critical to making sure this is, and the regulatory agencies in healthcare professions that are so critical in making this a critical component of the agenda. Dr. Mehari, would you like to introduce Dr. Woku, who is going to be moderating the next panel? Oh.
Hello, thank you again, Dr. Ekpe. Dr. Warku, I came to introduce Dr. Warku recently. We have been working in a committee at Marburg, and I have learned that she's an amazing scientist and leader with the global health. We have been serving in a